Hi and welcome. I'm trying to learn medicine. Today, conjunctivitis, and after we've done it, we're going to do stretching. And if you participate in the stretching, then it's at your own risk. And we're talking here about anatomy, internal anatomy, the eye anatomy, and the disease of the eye. And this is no medical advice. And this is part 2. And now we're trying to gather the information together, which we read in the first part about conjunctivitis, sort them and try to make a presentation about it. Conjunctivitis, inflammation of the conjunctiva, which covers the white of the eye and the inner surface of the lids. The inner surface of the lids. The white of the eye and the inner surface of the lids. Let's take one look. Here was something for the eye, I think. The ear? Yeah. Conjunctivitis. What were? There are 22 things, but not conjunctivitis. There are 12 conjunctiva. 12, that would be... I can't find it. No. I can't find it. Maybe here? 12. Okay, the graph, I don't want to show it to you. And it doesn't really explain more. I don't understand it, I don't want to show it. Okay. Conjunctivitis. It is inflammation of the conjunctiva and that covers the white of the eye and the inner surface of the lids. We're just going to quote them. The conjunctiva is inflamed that covers the white of the eye and the inner place of the lids, the inner surface of the lids. Conjunctivitis is the commonest cause of red and or sticky eyes and is sometimes contagious. Maybe we're gonna say that it is the commonest cause of red eyes. Maybe they mean an inflammation type of red eyes. Because there are other causes for red eyes. It could be that they are more common, but they are not from an inflammation or something. Symptoms. The symptoms are usually of gradual onset. Okay, gradual onset. The eyes feels gritty and irritated. They look red and congested. They feel gritty and irritated, look red and congested. I don't know what congested means. And they can become sticky and crusted, especially when waking up in the morning. Duration. Untreated conjunctivitis may last for 2 or 3 weeks. With treatment, the condition will clear sooner. Okay. Also, without treatment, it should go away in 2 to 3 weeks. With treatment, faster. The cause is a bacterial or virus infection. It can be also caused through irritants like tobacco smoke, cosmetics, or some proprietary eye preparations. It can be also the sign of a serious underlying eye disease or allergy, and also of a blocked tear duct. Treatment in the home, we're not going to say that much for it because not just this video but also the video when it's not as medical advice intended. Then you consult a doctor if your eyes are sticky and feel gritty. And if redness develops and does not clear within 2 to 3 days. If people were in tropical countries, then it I don't want to use a formulation which rules out that it can be with the people if the person was not in the tropics, even if that is maybe the case. There can be, which might happen if a person was in the tropics, virus infection. An infection of virus, and that would be then also dangerous for the eye, for the ability to see. And I think we don't have to say sleep and rest. Prevention. If the eyes tend to be sore, avoid irritants. Eye infections can be passed on by direct contact, so wash your hands after applying drops or ointment. The patient should use only his or her own towel and nobody else should use it. It can be spread by contact, so after touching, hand washing and using a separate towel of a person its own towel. It normally settles down after some time, after 2 to 3 weeks, even without treatment, with treatment faster. The eyesight is not affected if it's not trachoma, and it can occasionally persist and become chronic. The cause is usually allergic, rarely serious disease. Then is the cause mostly allergic or an underlying serious disease, which should be examined. If I say it, if by an examination through a medical person that was found out. But it's also if it was not found out that it can be an underlying disease. Okay, when to consult the doctor. If the eyes are sticky and feel gritty, and if redness develops and does not clear within 2 to 3 days. If there is severe pain, and if a person has pain or redness for 2 to 3 days, then they should see a doctor. Or if about the tropics, so that it is possible to have trachoma. Okay, but the difficult things. We're having conjunctivitis, the name. It is the surface. It was the surface of the white. Covers the white of the eye. I see with the surface. The surface of the white of the eye. It covers the white of the eye and the surface of the inner part of the lids. Conjunctiva. Symptoms are gradual onset and redness, gritty feeling, sticky feeling, and gritty both. They feel gritty and they are sticky. I don't know what gritty means. They feel sticky and irritated. They feel gritty and irritated and are sticky and crusted in the morning and have redness and are congested. Gradual onset. Clears up in 2 to 3 weeks. It can be through bacterial virus infection. It can be also a sign of an underlying allergic, tear ducts or tobacco smoke. And it can be trachoma, and that is it when it should go away. It can persist. It does not affect the eyesight if it's not trachoma. And the other thing which was, it can become chronic when it is mostly because of an allergy or an underlying cause. I'm going to start the second camera. And let's try the second. We have time for about 2 days. Conjunctivitis, that is inflammation of the conjunctiva. It covers the white of the eye and the inner surface of the lids. And it is usually because of a bacterial or virus infection. It can be because of tobacco smoke or something irritating or cosmetics. Now, and normally it goes away within 2 to 3 weeks, with treatment a bit faster. And the symptoms are gradually onset of redness and the eyes are sticky and crusted in the morning. And also, do they feel? Yes, if a person feels pain, they should see a doctor. If they feel pain, they should see a doctor. And it can be also that they feel sticky and gritty and congested. Now, and this is actually, I don't know what else. The trachoma part was missing. But other thing, it can be allergic. Allergic to a bottle is full. Conjunctivitis, that is inflammation of a conjunctiva. It covers the white of the eye and the inner surface of the lids. And it is with gradual onset, and it lasts for 2 to 3 weeks and goes then slowly away with treatment a bit faster. It is redness of the eye, and they feel gritty and a bit congested, and they are a bit sticky and crusted in the morning. And the reasons for it, they are usually a bacterial or virus infection, but it can be also because of tobacco smoke or cosmetics, or because of an allergic reaction, or of an underlying disease. Now, and it can be also, which is likely, which happens if a person was in the tropics. When can it happen? So if a person was in the tropics, when that could be that is the case, that it is trachoma, and that would be dangerous for the eyesight, for the ability of the eye to see. Now, and what was this? The tear duct, I want to mention. And the other thing, I'm always stumbling over. It was proprietary eye preparations. Proprietary eye preparations. That is it. There is not much more. Conjunctivitis. The conjunctiva is the part of the outer face of the conjunctivitis. The conjunctiva covers the white of the eye and the surface of the inner lids. Now, and conjunctivitis is inflammation of this conjunctiva. And over gradual onset, over 2 to 3 weeks does it last, and it then goes away with treatment a bit faster. Now, in these symptoms of gradual onset, they are redness and feeling of gritty and congested eyes, and they are sticky and crusted in the morning. And the causes of it are usually bacterial or virus infection, but it can be also through an allergic reaction, or because of eye preparations, or of tobacco smoke or cosmetics, or it can be also in some cases because of an underlying disease. And if a person was in the tropics previously, then it is possible that it is the trachoma virus, and that would be dangerous, because that would be then affect also the ability of your eye to see. To avoid it, if your eyes are dry, don't irritate them, and also then if people have it, it can be transmitted, so that they wash their hands after having touched their eyes and use a separate towel. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 177 and 178, but this is no medical advice. I forgot the thing with the tear ducts. But we don't have time. I'm going to stop the camera. That means we have to remember that part. Now, if you are here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, and as well as the armrest, connect standing, go to the stable. No, wait, not. We're staying together. They are standing together. And we're doing the rooting tree. One foot goes to the outside and the other. The heels to the outside and the heels. And toes, and heels, and heels. And again. But too late. And up. Now the next exercise, relax standing wide apart, and you're breathing in a little bit upset. And you're breathing out and down to the side. In and out. Out over to the other side. In and up. Arms down. Breathe again in. Out, one hand slides down the leg, the other shoulder stays down. Breathe in. And down the arm over. Breathe in and down the rib cage. And breathe back into the middle. Breathe again. And out to the other side over. Breathe in. And out one arm over. Breathe again in. Out back into the middle. Breathe again in. And out the road down. The Niagara Falls. Breathe again in. And out over the one leg. Again in. Out over the other one. And in. Out into the middle. And now close the feet. Breathe again in. And out. Again in. And out comes slowly off the round back, up the back to top the back with the shoulder. Legs wide apart, we're closing, we're breathing in, going down. Again in, out, and another round, breathe in, out, again in, out, now breathe in, close the legs, and breathe again out. Now that was a short stretching. Thank you very much, and until next time.